When you were little, your parents probably made sure you had an annual checkup with your doctor. As you've grown older, you may have gotten out of this habit. More likely, you avoid annual health checks as you're busy, or maybe you just don't want to learn you have a disease. A health checkup consists of a series of tests that are designed to check if you are on the right health track. The basic goal of a health checkup is to find the hidden disease in your body, prevent it from becoming a major health issue. By taking up regular health checks, you're increasing your lifespan by improving your health and preventing it from deteriorating. Today, health checks have become quite sophisticated, and you should look for an element of personalization in them. Every individual's health check plan is tailor-made. DNA genome analysis test is also worth checking out. The report will help in understanding your risk of developing a particular disease. Discussions with your physician forms an integral part of the checkup. So you will need to have your test analyzed by medical experts who will interpret your test results and the way forward. In this episode of Let's Talk Health, learn all about health checks, and then it's time to take charge of your health.
Prevention is better than cure. This old proverb holds true in today's fast-paced life, especially when it comes to your health. Many health problems can be managed effectively if detected early. Preventive healthcare also makes more financial sense.
Preventive health check is a comprehensive check that looks at screening individual organs to look at the slightest symptoms that could lead towards the diagnosis of a major illness. The goals of a preventive health are to promote, to protect, to maintain a good lifestyle. And preventive health not only prevents diseases, but it also prevents disability and death. A comprehensive medical history taken during a preventive health serves as a good personal record for future reference.
During preventive health checks, the doctor determines the health screenings that are suitable for an individual. The tests are based on several factors like age, gender, personal health history, and the current health condition.
Everybody needs a preventive health check because all that glitters is not gold. And looking at the lifestyles, people are compelled to keep up with this competitive world, and eventually when they're faced with a problem, a medical complication, that is when they think of going to their doctors. So all that glitters is not gold again, and we feel that we look wonderful on the outside. We may be doing all things right, eating a sensible diet, exercising, feeling great, but we don't know what actually is happening inside. There are a lot of diseases that are asymptomatic. We may not know that we have certain diseases. Examples are early stages of diabetes, certain cancers. And some of us are genetically predisposed to certain conditions. We feel well on the outside, but we may not be well on the inside. Again, it's very important to have a health check because age itself is a risk factor for cancers, and certain cancers can be screened earlier on, like colorectal cancer with screening colonoscopies, prostate cancer with a PSA mammogram, so on and so forth. And preventive health also is very important. When it comes to communicable diseases, people talk about vaccinations. When we talk about vaccinations, we think of children, but adults too need vaccinations.
Routine health checkups and screenings can help one avoid serious health problems. It allows the doctor to detect and treat the disease better, and also helps the patient to recover sooner and lead a much healthier life.
people sometimes have a fear of investigation. One, they're afraid that they may be diagnosed with a condition and they're afraid that they may not be able to come to terms with it. Two, they're also looking at health costs. They're thinking that if I have a health check and they come up with something, will I be paying a lot from my pocket? Is that going to pinch my pockets? And they may not be ready for that sort of expenditure. Three is the lack of awareness. People think they look good, they feel good, and they feel that they're invincible. So in all these cases, if you do have a health checkup, what I'd like to say is once you've had the diagnosis, you can alleviate your fears. Two, of course, your health bills are going to be reduced a lot if you have a health check in time and if diagnosis is made early. Three, nobody is invincible, and people looking good on the outside, we don't know what's happening inside.
In this episode of Let's Talk Health, we look at the stories of two individuals who took charge of their health by opting for preventive health checkups. Paraniyappan was 50 years of age when his wife convinced him to go for a thorough health checkup. Without visible symptoms of any ailment, Paraniyappan was confident about his medical reports until he saw the results.
Before met a doctor, I didn't feel anything else. I really surprised with this kind of 3 blocks and affecting my heart. I didn't feel at all. But when I heard the word from the doctor, I surprised. The doctor asked me, "Have you come here after taking found any symptoms?" He asked me, but I told that no symptoms was felt by me before that. Just I went for routine checkup. During the routine checkup, they found that this one.
An engineer by profession, Paraniyappan had been living with diabetes for long. But he never realized that it could potentially become a threat to developing a heart ailment.
Mr. Paraniyappan is a diabetic and he had no symptoms on presentation. In fact, he had a minor symptom. He had a leg pain, a niggling leg pain. Other than that, he just routinely booked for a health check. And we personalize the health check for him. By personalization, I mean that we choose the tests that are appropriate for that particular patient. And he being diabetic, of course, he has a risk of heart disease later on. So we did a treadmill test, which showed to be positive, and then on he went to have an angiogram, which showed a block of one of his major vessels, following which a stent was put in.
After the reports confirmed blockage in Paraniyappan's arteries, he was advised to undergo an angioplasty and stenting procedure. Coronary angioplasty opens the arteries and restores normal blood flow to the heart muscles that become blocked or narrowed from a buildup of cholesterol or other substances from fluids called plaque. The doctor numbs the skin in the groin area or arm and inserts a needle in the arteries. Once the needle is placed, a wire is passed through the needle and gently guided to the heart. The doctor withdraws the deflated balloon and catheter from the artery.
Doctor told me that you have to take 3 days. You have to be in the hospital, and another 1 week light work you have to do. Then you can proceed your routine job. Accordingly, I took 3 days leave and attended the hospital. One day, first day treatment angiogram work completed. Next day I become all right.
Paraniyappan had a swift recovery after the procedure and started doing simple treadmill workouts to keep a tab on his weight and prevent further blockages. Today he maintains a healthy life and is back to working with more enthusiasm and vigor.
It's ever so vital to have a health checkup, and everybody must have a health checkup because life, of course, is precious, and spending that little bit of time and a little bit from your pocket towards your own health is very, very important. And of course, now that we have the option of personalizing health checks, I would advise for people to go for a personalized health check where we look at you in total, because a health check, as I said, is just beyond a set of tests. It's about prevention of communicable disease. We talk about vaccines, and we tailor according to the need of the patient. A set of tests may not suit a particular patient, but we tailor the tests according to the patient's needs.
Santana Krishnan had lost interest in going for his evening walks, but he never thought that the underlying cause could be a serious health condition. Watch his story on the other side of the break.